On this first day of gradual reopening in Ontario, an Angus Reid poll finds the majority of Canadians, 54%, want restrictions to end. We've been hearing a definite shift in messaging from health officials that we have to learn to live with COVID, but that means something different for everyone.
We can't eliminate this threat, in fact, we have to learn to live with it.
That was last Thursday, the first time Ontario's top doctor made that statement, adding that people have been living with fear for the past 2 years, and it's time to change some of that thinking. But learning to live with COVID isn't the same for everyone.
Living with COVID to me is accepting that it's here, accepting that it can cause some harms, taking calculated risks, and making sure that we have some protection in the population based on prevention measures that can try to keep us safe at a baseline level.
Dr. Hoda acknowledges a calculated risk is different for a younger, healthy person who is vaccinated versus one with underlying health issues.
It is a little bit unbalanced. If you are younger and otherwise healthy and don't have risk factors for severe COVID illness, then, with 3 doses, yes, your risk is low. And even if you did get infected with COVID-19, you likely would do fine. But, there are some people who have things they can't change, like such as their age or, medical comorbidities and other health conditions that put them at risk for severe illness. And, if they don't want to end up in the hospital, then, that would require more measures and more caution. There is this inherent inequity amongst people.
But more and more people are ready to leave COVID behind. Today's Angus Reid poll, conducted on January 27th and 28th, found 54% of Canadians believe it's time to end COVID restrictions and leave it up to immune-compromised people to protect themselves. That's up from 40% from just over 2 weeks earlier. The good news is cases are receding.
We know from wastewater testing and we know from test positivity, which is actually the more important measure, that cases are dropping. And what we know with outbreaks is when they start to drop, they continue dropping, they pick up speed in the same way that increases pick up speed. So we've seen really clear indication that they're dropping.
Epidemiologist Colin Furness initially decided to keep his children home from school when they reopened almost 2 weeks ago. After doing a risk assessment, he's decided to send them back. He believes if there was going to be a wave in their schools, it would have happened by now.
There's been time for that to happen. In other words, it would sweep through schools if you give it the chance to. My neighborhood, my demographic seems to be pretty well vaccinated and doesn't seem like there was a significant wave through. But if that were to happen, it likely would have happened already. And
now, Furness says his children don't take the bus and can come home for lunch. They also have N95 masks, and there are no vulnerable people in the home. That's not the case for everyone, though, and he says that significantly changes the risk.